You're listening to The Q Switch with your host, Spence.
Welcome, one and all, to the Q Switch Conversations podcast. I'm your host, Spence, and the mission of this show is to tackle subjects currently impacting ophthalmology, where we attract the innovators, the thought leaders, and forward thinkers shaping the field of ophthalmology to discuss their unique perspectives. So let's jump right into it. My guest today is someone who sees the big picture and the fine print when it comes to eye care. Dr. Stephanie Mulick is a Southern California native who's been helping patients in South Orange County see the world more clearly since 2006. She earned her doctorate of optometry from the Illinois College of Optometry, graduating with honors in patient care. And before that, completed her undergrad in biology and chemistry at Cal State Fullerton, where her fascination with how we see first began. Her training spans from Illinois Eye Institute to the Las Vegas Veterans Hospital, the Southwest Eye Center in Arizona, and the Eye Center of North Florida, giving her a deep foundation in everything from cataract and glaucoma co-management to pediatric and family vision care. But what really sets Dr. Mulick apart is her heart for service. She's volunteered in vision clinics across the U.S., Central, and South America, bringing clarity, quite literally, to those who need it most. Today, she's part of the team at Tiana Institute, where she blends clinical precision with compassion, caring for patients of all ages, from the littlest first-time glasses wearer to adults managing complex eye conditions. Dr. Mulick, I am so glad to have you on the Q Switch. Welcome to the show.
Thank you so much. That was a nice introduction. And I actually been watching your podcast, and I wanted to thank you for bringing this to the public, just awareness of early vision detection.
Well, my pleasure, and certainly needs to be highlighted and more awareness built around it. So loving to have this conversation with you. So let's start at the beginning. You shared with me that your own first pair of glasses changed everything for you. What was that experience like, and how did it inspire the path you're on today?
Well, thank you for asking. So when I was in kindergarten, I was struggling in school, and actually the teachers told my parents that I needed to be held back in kindergarten. It turned out that really I just wasn't seeing clearly. So as soon as I got my first pair of glasses, everything changed. It became much easier in school. I remember trees looking like big blobs of green actually had individual leaves. It was amazing to a little 5-year-old. I also remember my neighbor across the street was so jealous that I got glasses that she pretended at the eye doctor that she needed glasses too, which is very common, actually. I see that often, and children come in around that age. They actually think it's cute and want to get glasses. That really changed my perspective on early vision detection, because me firsthand realized how much I was struggling when really all I needed was to see clearly. And unfortunately, that happens often because children typically don't get vision screened until they are in school. But if we had a way of maybe educating the public earlier, telling parents of maybe preschoolers to have eye exams, then we might be able to catch things earlier than once they're in kindergarten and struggling to learn to read and learn their alphabet and such.
Mm-hmm, mm-hmm. It's amazing how something so small, a pair of glasses, can completely change a child's world. When you think about your own experience, how early do you think we should be catching vision problems in kids, and why is that early window so critical?
There are studies out that say the earlier we catch it, the better for the child, because the visual pathway is developing basically from the time we're born. And then there's a critical age period. They usually say around 8 to 10 years old. It doesn't mean that it can't get helped after that age, but that's kind of the time period when our visual pathway is the most plastic, as they would say. Plastic meaning that if you can get your vision clear at a young age, then the visual pathway is more likely to develop properly. In fact, I believe it was yesterday or Wednesday, I had a patient. He was 5, so the mother was very proactive. She got him in. It was a school screening, though, so they caught it at school, and it turned out he had what's called amblyopia. Now, amblyopia is the medical term that some people say lazy eye or amblyopia. But for this child, he had both eyes were extremely farsighted. So basically his focusing or accommodative system had to work extra hard for him to see. And he was only best corrected to 20/70, which at age 5, we expect the vision to be quite a bit better than that. So we got him some glasses. Well, not yet because it takes, a little time, but we're going to get him in. And then we told him about 8 weeks, he's going to have to wear these glasses. He's going to come back and we're hoping that his vision's going to improve. Now, in his case, both eyes were the same, but in some people, they have just one eye that's bad and one eye that's good. I shouldn't say bad, but one eye that may have a farsighted eye and one eye that does not. And what happens in those kids is often they will turn off, or the brain kind of suppresses the image from the eye that's blurry and favors the eye that is clear. So when that happens, then sometimes, let's say my right eye is really clear, but my left eye is a little bit blurry. What happens in kids is that visual pathway on the left eye doesn't develop fully, and sometimes they don't reach 20/20 vision. So that's why it's so imperative that we get that evaluated at a young age, because for people like that, where it's one eye, oftentimes we'll have to have them patch the eye that they see well out of, stimulate the visual pathway in the eye that they don't see well out of. Amblyopia has actually many causes, so I could talk to you about that a little bit. But one of them, I think, which is more like the lazy eye, is where one eye turns. So you might see a kid with an eye turning in or eye turning out. When that happens, that's called strabismus. And the eye that is turning then gets suppressed, just like I was talking about. There's also other causes for children to have this. Sometimes they are like a lazy eye lid, where the eyelid kind of wants to close and then light can't even enter the eye. So that's called a ptosis. So kids can actually be born with what's called a congenital ptosis, and it blocks the light from entering that eye. Kids can develop a cataract at birth. So that's called a congenital cataract. Same thing, it would block light from coming in, and then that visual pathway can't be stimulated. The front surface of the eye, the clear part, is called the cornea. And if there's an opacity there, then that blocks light from coming in. And then the cataract happens here in the lens. So all of those reasons could cause what's called a lazy eye. We don't call it a lazy eye, but that's kind of what the layman's term, but the amblyopia. And then...
Well, let me ask you. So, I mean, you just went over a series of reasons that causes of amblyopia, and that kind of brings me on to that question again. So how early can you actually identify whether a kid is getting affected earlier in their life with something like this? Is it babies? Is it 2? Is it 5?
Babies. We can check babies. Often for babies, we do have to dilate their pupil, and then we can use an instrument called a retinoscope. I wish I had one here, but I don't. But it's a little light that we can shine in there, and it gives us a reflex from shining it onto the back of the eye or the retina, and that can help us determine how long or short the eye is. So if the eye is really short, then they're more far-sighted. If the eye is really long, they're more nearsighted. And then there can also be causes like astigmatism and things like that. But that light will help us in little kids. There's even actually a machine called an autorefractor. You've probably had it. People come to the eye doctor and then they look and they see like a hot air balloon at the end of the road. So that's got an autorefractor. But they actually make some for children that you can do. I remember when my daughter was a month old, I did it on her. You literally just hold it and you're probably about 3 or 4 feet away from the kid, and it lights up and it looks like a little smiley face. So they're looking at it, and it can actually give us an autorefraction of an infant's eye.
Huh.
Yeah.
And this is especially designed basically for kids.
It is, yes. I was really lucky because I got to work with Dr. Sidney Weiss. He's a board-certified ophthalmologist, but also a strabismus surgeon and pediatric ophthalmologist. And he also was a professor at the Jules Stein Eye Institute at UCLA. And I got to work with him for 6 years. So that was really a fun experience, and it taught me a lot about pediatric eye care, because that's what we always saw. So that is actually where we had that little device, and it was so fun for the kids.
So, and I have some other questions about that later in the interview too. So save some ammo. So you graduated with honors from Illinois College of Optometry in Chicago, and before settling into practice, you did several international eye care missions: Honduras, Guadalajara, and the list goes on. How do those experiences shape your approach to care and connecting with your patients?
Those were really rewarding experiences. When I was in my last year of optometry school, I got to go to Honduras. That was the Honduras when it was through a organization called SBOSH. And they went around and got, a team of eye care professionals. So I was still a student, but in the last year, so that was neat. But these people where we were serving never had access to any eye care. So some of them were in their 50s. Some we had, 5 or 8 year olds too. So I would say we had a giant span, even up to 90 years old, of patients who had never seen clearly. And it was really amazing because when we basically were doing these little refractions on them, and then we're finding out what prescription they need or what's called the refractive error. And when we get the refractive error, we most closely match it to whatever donated glasses we had, which were
Ah,
hundreds.
uh-huh.
They're all labeled and you look and sometimes, it was an exact match, but sometimes you might get one eye like really, really close and the other eye might be a little off, but close enough. And these people, when they put them on, literally were crying because they had never seen before, giving us hugs. And the same thing when I went to Guadalajara or Honduras later. Now I'm getting all mixed up on the dates, but when I went to Guadalajara, that was when I was an optometrist, and it was the same thing. Such a rewarding experience. And in fact, the second trip I went to, we had a group of ophthalmologists doing cataract surgery, and that was life changing for many people. And the surgeons were just telling us how these cataracts were so dense, nothing like you would see in the United States, because they just, the cataract got worse and worse and worse, but they never got treated for it. And so these people would come in with almost no ability to see. Maybe they could see your fingers, or some of them only the perception of light. And you would do these cataract surgeries on them, and all of a sudden they could see again.
So you mentioned a lot about the mission trip moments and how it impacted you emotionally. Children, I think, in general, are a very unique population because they can't communicate like adults. And then you take the added component of being in a foreign country, and again, just that whole situation that they're in. Is there anything you can take from those experiences when you treat kids in other countries that you bring back and can apply to your day-to-day here in the United States?
So when we're doing these in other countries, it's very, what do I want to say, kind of basic eye exam. It's nothing like we could do in the United States because you only have so many tools that you can fly out there. And
Of
we
course.
didn't have like a big microscope with us or a big phoropter, the little machine with all the lenses in there. That would have made it really easy. But it did just help. Just we were able to check their vision and, like I said, their refractive error. And as far as children learning in school, it makes a huge difference for them. So when they're seeing clearly, they're going to do much better in school. But as far as what I take from that to here, I mean, I think just what a rewarding experience to be able to help people of all ages, but especially knowing when you're helping children that you're helping their future so that they can have not only better vision, but better self confidence. And um, I think that makes a world of difference to them.
And I imagine kids are the same in Honduras and Guadalajara as they are in Orange County and here in Miami. So I think there's kids are
Yeah.
kids, I guess, no matter where you're at. So you've worked with some amazing, remarkable mentors. You've already mentioned Dr. Sidney Wise at UCLA, and I'm sure now under Dr. Ramin Tayani at Tayani Institute. What did you take away from those mentors that most influences how you practice today?
So with Dr. Weiss, I kind of talked about that already. He just
Hmm.
really gave me a really strong foundation in pediatric eye care and complex amblyopia refractions and strabismus and treatment of amblyopia. Used to have these cute little patches so kids would get their glasses and then they could actually slide a patch onto the lens of the frame. It was like a little cloth thing and it was really
Hmm.
cute. And there's different ways to treat it. So we could use, sometimes people use drops if kids are really, a lot of kids will just take the patch right off. It depends on the child, obviously. Every child's different, but if they just take it right off, then sometimes the patching doesn't work as well. So then we have to use alternative means like putting a drop in their eye that kind of blurs the eye that they see well out of. With Dr. Weiss, I actually worked all the way up until probably about 2 months before my daughter was born. I actually got kind of put on bed rest. So I stopped working and then I stayed with my daughter for the first 10 months of her life. And then an optician I knew reached out and said, "Hey, are you looking to work?" And she said, "Well, Dr. Tayani is hiring right now." And she worked for him. And so kind of the rest was history after that. But Dr. Tayani was probably one of my best mentors as far as me gaining confidence. And maybe just because I was older and a mother at that point, too. I think your life changes just being a mother. But
Hmm.
also at that point in my life, Dr. Tayani he has a huge heart and he just really pushed me to become the best I could. So I really appreciate his, wisdom and everything he's taught me. He's an oculoplastic surgeon, so
Okay, all right.
his surgeries are pretty amazing. In fact, well, it's on my phone that I turned off, but this patient had eyelid cancer
Ooh,
and
that I've never heard of. Eyelid
literally
cancer.
yeah, it was intense. So it was about 5 millimeters vertically and about, I think he said 3 centimeters across on the upper eyelid. So pretty
Huh.
much almost the whole eyelid
Yeah, yeah,
had
yeah.
to be removed. And Dr. Tayani had to reconstruct it. And I was with this patient throughout his post-op visits. So first, it was the most interesting. I'm kind of going off topic, but it was so interesting. I have to share. He goes and he takes the skin from here. So this patient was older. So, I'll have a little bag we could get
Yeah,
rid
yeah,
of.
yeah, yeah.
He takes the bag and he brings the skin up and created a whole new eyelid on the top.
No
The
way.
eye was then sutured closed for about a month. And then he opened it up. And I just saw him on Tuesday and I literally took a picture and sent it to the whole management team and said, "I have to give a shout out to Dr. Tayani. This was amazing. You could not tell that the
Really?
patient had no." Yes, it was
That's
so
nuts.
amazing. I couldn't
Oh my
believe it.
God.
Yes. And the
You gotta
patient
text me
was
that picture. I
just,
want to see that. You gotta
I
text me that
will.
picture.
He was like ear to ear smiling, and his wife was there. And the patient was really cool too because he actually, through the whole process, he signed a little waiver that they could do a video of him. So through the surgery, they videoed. So I think it's going to go on our YouTube page or something like that. It was fascinating.
Yeah, that is a
The
really great
things he
case
can
study.
do. He's helped so many people, not just with skin cancers, but, cosmetically and things like that, or people who get into like accidents and cut their orbit. Sometimes he actually has to remove the eyeball too.
Yeah, yeah.
Totally different, but he does work on children as well because obviously sometimes they need reconstruction too, like I was talking about with the eyelid ptosis, where the eyelids droop. He fixes those even in infancy because the sooner we can fix those, the sooner a kid can develop vision out of that eye, and that's what we
Hmm.
want.
Right. So you've clearly found your lane in pediatric vision care. What drew you so strongly to that specialty, and what makes working with kids uniquely rewarding and maybe a little bit unpredictable at times?
I never really called myself like a kid person. Even when I met my husband, I'm like, do we want kids? I don't know. But I think working with Dr. Wise for that 6 years, it just gave me a strong foundation there in pediatric eye care that I really enjoy it. And I actually have fun with the kids. They're so sweet and when you get a child to see clearly, it is definitely rewarding. Adults too, of course, but most of the time adults, they already got their glasses and you're seeing them maybe with a little change here and there, it's not such that wow factor where you get these kids and you can really change their life if you can catch these types of issues early.
Well, I also noticed that you like your personality and the way you carry yourself. Like when you explain things, it's like at the basic level, so that you're talking to parents or maybe even a child that can kind of understand what's going on. And because you and I can have an ophthalmology or eye care conversation, we're in the profession, we're in the industry, we have to know the same terminology, we've been around this stuff a while, but these folks who walk in your door every day, they're not going to get what the sclera is, the cornea. You have to break it down and make it simple so they can kind of digest it and understand what's going on with their kid. And just how I'm interacting with you now, you have that personality and you can convey this person's condition or their kid's condition to them in a way they can understand and understand that, we've got, not only we've identified what's, the issue is, but also the solution to make sure that they get taken care of and they can, again, have a better quality of life and do better in school.
I think that is very important actually, because, going back to me as a child in glasses, when I went into optometry school, I didn't really know that much about the eye. I actually, I worked in an optical shop where we gave people glasses. So I knew a little bit about, adjusting glasses and things like that and helping them pick out glasses that looked good on them. But as far as the structure of the eye, I really didn't know. And I think maybe that is why I do that, because I wish that I had gone to the eye doctor since I was 5 every year. I started wearing contact lenses when I was 10 years old,
Oh, wow.
and they
Okay.
were really hard, not very comfortable. And if the doctor had explained, I think well, for one, it just makes more sense, right? When you understand something, I feel like it makes more sense why you're doing something, but also for just myself to know I am kind of inquisitive, and as a child, I think it would have been neat to explain that. In fact, I had a patient the other day with his dad, and the dad said, it was a school day, and I said, "Oh, no school?" And he said, "Well, actually, we're homeschooled, so this is his eye doctor class." And I said, "Perfect." So I got out my eye model and I took a picture of his retina and explained where the optic nerve was. The dad was so appreciative.
I'm sure.
And the kid was really interested in it as well. And it was kind of a fun exam for all of us. And I said, "Okay, you got an A plus today."
So, building on that, optometry itself is evolving quickly. We're seeing more and more optometrists carving out defined niches and subspecialties. From your perspective, do you see specialization as the future path of the profession? And for optometrists coming up that have a passion for pediatric vision like you do, what recommendations do you have for them to develop that into a career serving that underserved population?
That's a good question. So, yes, I do think that the specialties are definitely the way of the future. The eye, it's a small organ, but it's very complex. So you can have a specialist just in the cornea or just in contacts or just in amblyopia. There's so many specialties, just in dry eye, even just that one eye disease you can have a specialty for. So, but you can also, have your general optometry as well, because just like physician, you have your primary care physician. So that's what's kind of unique with Dr. Tayani's clinic. He has such a big group of doctors. We have 6 optometrists, and we're kind of like the primary care, but each of us do have our own little specialty.
Really?
So, for instance, Dr. Guck in my practice, he's our dry eye guy. He has his whole dry eye clinic. And then Dr. Moyne, she does all the specialty contact lenses. So
Okay, right.
if someone has what's called the conus, or, if they need, there's a lens called a scleral lens. If someone has different eye conditions or corneal conditions, she can help with that. And then we have different specialties in our ophthalmologist as well. Dr. Hosen is our glaucoma specialist. He does cataract surgery, but a lot of glaucoma surgeries and things like that as
Like MIGS
well.
and that kind of thing.
And I talked about Dr. Tayani. He does the eyelids and all of that, but he also does cataract surgeries. Most of our no, I shouldn't say most. We have a retina specialist. She doesn't do cataract surgery. She does retinal injections for like diabetes, or she'll do if someone has a retinal hole or tear. And then we have Dr. Banuelos, who's pediatric, and her and I work pretty closely together. In fact, just the other day when I was telling you about the patient I had with the really high refractive error, I immediately got on the phone with her and said, "This is what my plan is. Let's, talk about it together. And then I'm going to send him to you for the follow up. And then you and I can kind of work together." So it's a neat practice to work in because I can always refer to the ophthalmologist if I do have any questions. Like if I have one of a glaucoma patient, I'll just call up Dr. Hosen and say, "Hey, this is what I got going on. What do you think?" And so that's pretty neat. But working in any kind of specialty, I think in optometry is going to just allow you to focus more on that one thing, which as a human, if we focus on something, we get better at instead of, focusing on everything because we can't be a specialist of everything.
Right. Now, the back half of that question was about like if there's anybody who does have a passion or have that calling to really focus on the pediatric side of vision care, like you. I mean, I don't think there's up to this point, unless you can correct me if I'm wrong, that there's not like a pediatric subspecialty for optometrists at any school. You had a kind of a quasi one with Dr. Wise, but there's nothing organized now? I mean, what kind of recommendations would you give those folks who are seeking out those kind of opportunities to treat that demographic?
So that's a great question. In optometry, we get our bachelor and then we go to optometry school and then we get our doctorate after the 4-year program. And then after that, you can go out and start practicing as long as you get your state license and all of those things. And you could also decide to do what's called a residency, an optometry residency.
Oh, okay.
And there is a pediatric residency.
There is. Okay. I was surprised. Okay.
Yes. So when I graduated in 2006, there was residencies then too. And at the time, information that I was receiving was that if I was planning to work in California, that the specialties didn't do a whole lot at that time. Now, I don't think that holds true now. But at the time, people were kind of like, you may not want to do it if you're just planning to work in California because there's a lot of laws and this and that, and you can't really say you're a specialist. But I think nowadays it's definitely changed. And you can, say, "Hey, I got this residency in pediatrics." And that's usually about a year program. So
Okay.
I guess I kind of got my 6-year program.
And when you talk about kind of how it's structured in the pathway, that it's like a fellowship in ophthalmology. That's a 1-year specialization in that whatever glaucoma, other than retina, which is a 2-year.
Yes.
It's just you focus on just those eye conditions, those remedies, the treatments of that specific thing. In your case, pediatrics, and I'm sure there's others.
Yes, there's a lot of others. So there's low vision, there's specialists who actually help people, especially if they have like macular degeneration or things like that. There's
Hmm.
low vision aids that they can help people who have limited vision to kind of help magnify things. And there's contact lens specialties, just like I was kind of talking about different lenses that you can work with. There's ocular disease specialties, so people who are more interested in the disease aspect of the eyes. There's lots of things you can do in optometry, but it is a very rewarding profession. Even
I'm
if you're
sure.
just doing general optometry, I would say making people see clearly is pretty cool. In fact, just the other day, I was telling my husband, now that I've gotten to step back a little bit from management and do more patient care, I got a couple hugs the other day. And that's
Nice.
always neat because you're making the patient happy.
Yeah. Kind of turning it back to kind of the theme of the episode with, vision and children and all, and you kind of led into this when we first started. The connection between vision and learning. The numbers are staggering. Quarter of kids, if I recall the data you share with me, a quarter of kids have vision issues
Yes.
that affect their education. So what are some of the signs teachers or parents can look for that might hint at a vision related learning challenge?
Yes, I like this question. So actually, I printed out the statistic just so I didn't quote it wrong, but it was the American Optometric Association. They said about 1 in 4 children, roughly 25%, have a vision disorder that requires diagnosis and treatment by an eye doctor. So you're right, that is pretty staggering. And then I have another one I printed that was also very interesting. The National Center for Children's Vision and Eye Health Prevent Blindness said undiagnosed or uncorrected vision problems are associated with poor academic performance and classroom behavior. So that's pretty sad, actually. Often, even when I'm seeing patients who aren't pediatric, but they might have children, I typically ask, do you have any kids or, family that need an eye care or anything like that? A lot of them don't even realize that their kids need an eye exam. They will say to me, oh, they see fine, or, and I'll say, well, you don't necessarily know. And the best thing to do with a kid is really, truly just cover one eye, have them look far, have them look close, do the same thing with the other eye, because you'll really know if a kid is favoring one eye. Because if you cover the eye they're favoring, they're not going to like it very much. They're going to start fighting you. They'll try to move your hand away because all of a sudden you make it so they can't see anymore. So that's one sign that parents can really, it's a pretty easy thing to do. And then obviously, more obvious is sometimes when a kid has a turn. Although I think sometimes people don't notice that either, because I've noticed in kids, and it's a fine line because we'll be out and about and it's like, do I want to tell this parent their kid looks like they might be at risk? And I'm like, I feel like it's my job, but then also I don't want to step on any toes. And sometimes I do. I'll try to do it in a nice, like discreet way, like, oh, hi, I'm an optometrist, and I just noticed your son's eye kind of turns in a little bit, and it might be a good idea for them to have an eye exam. But it is something I think as a parent, sometimes maybe we are not noticing, or me as a parent, you never want to think there's anything wrong with your child either. So sometimes you just ignore things. And I mean, I remember my own daughter in preschool was having trouble talking, and the teacher was like, you should probably get her into speech therapy. And I was like, are you sure? Are you sure? And then we did, and immediately she started speaking better. So sometimes I think as a parent, yeah, you're not really seeing everything that someone else might be seeing. So it's just a good idea to get a child checked, especially before kindergarten. And if you do, literally just an eye cover test on your kid and notice something, you definitely want to bring them in to see an eye doctor, because if they're favoring one eye, then they're probably shutting off the other eye. And then that is a lifelong thing that they're dealing with. In fact, up there's a book called Fixing My Gaze by Susan Berry, and she's a neuroscientist that had a strabismus, meaning her eye was turning. So she had what's called alternating strabismus, which is a little better because as a child. So it means sometimes she was favoring her right eye and sometimes she was favoring her left eye. It just depended. It would alternate. In those cases, it's actually a little better because they're stimulating both eyes, just not together. So typically those people are still getting at least some visual input out of both eyes, as opposed to somebody who's only fixating out of one eye. But it's a fascinating book because she talks about her journey as an adult trying to learn to get what's called stereo vision or depth perception. And it's an interesting read if you're ever bored and want to read a book.
So even though pediatrics is your passion, you also see adults. How has working across age groups helped you understand how vision evolves throughout life?
You asked some tricky questions. Things I have to think about. Let's see. Well, obviously, I talked about for kids, we want to make sure that they're seeing properly, because not only for learning and their confidence, that's going to help them throughout their life. But even as an adult, I have many adults who, reach the age of maybe 40, 45, even 50. And I think there's kind of a stigma, like I'm getting old, so I can't wear glasses. If I wear glasses, that means I'm old, right? And I get that a lot. And then I go, I've worn glasses since I was 5. No, I try to be a little nicer than that. But anyways, I understand that, they're like, I can't see anymore. I'm getting old. But I think once you show them and explain to them, this is the reason this is happening. I show them my little eye and talk to them about the lens and how it grows from the time we're kids and it gets thicker and then eventually we can't focus anymore. It's a natural thing that happens. It doesn't mean, you know, you're getting old. It means you're lucky to be alive and that you need reading glasses is kind of the thing. But I think just the field of optometry is pretty amazing, and the fact that we can see people from birth all the way to 110 if we get to live that long, and we can help each one of them.
Well, what I find, you have that eye kind of at, arm's reach, that you are really about
Yeah,
educating the patient. And I think in across all of medicine, but particularly in eye care, educating the patient, because again, it's a small organ, but very, very complex. So when you can take the time and you have the ability and the people skills to be able to educate them so that they understand what's going on, it really, I think, makes the patient experience in the clinic, no matter if they're 5 or 55 or 105, it makes that experience a lot easier for the patient. And you certainly have that skill and that natural ability. And I can sense that just, by talking to you today.
thank you. I know a lot of my patients with dry eyes, one of the symptoms is watering, and they're always going, "It can't be dry, it's watering. What do you mean?" And I say, "Well, that's your reflex here because your eye's getting so dry
Hmm.
that the eye starts watering." Now, in kids, when they get watering, oftentimes it's not dry eyes. Sometimes kids can get a little obstruction, and often when they're born, they can have an obstruction in the duct that drains our tears. Some kids outgrow that. So sometimes we can watch it or just do some hot compress and they'll outgrow it.
Hmm.
But some kids actually need surgery. And these
Really?
types of surgeries, again, Dr. Tayani does. So I've gotten to sit in the operating room with him while he was doing the surgery. And it's very fascinating. They actually like break the bone
Oh, goodness.
and create whole yes, they create a whole new canal for the tear to drain. So it's
Crazy.
quite fascinating. But it hardly you can't tell after there's like the smallest little line, and in kids, like no scar at all, really. It's hardly any. You would think when you're watching it in surgery, I don't know if you ever get to watch surgeries, but it's a fascinating surgery.
I'm going to ask about I See It activity book series. It's such a creative way to reach families. What inspired it, and how does bringing a little creativity and storytelling help bridge the gap between the clinic and the community?
Thank you for asking. My daughter inspired me, but she asked me to not tell too much the reason why. But anyways, she did inspire me, but I will be a nice mom and not really but she knows all about, how to work the computer and all this. And she did something and I said, "Wow, how'd you do that?" And then she taught me kind of how to create a book, basically. That's the best way I could say it. And when I was a kid, well, my dad was an art teacher. So growing up, I grew up actually with like the original Apple and Commodore computer at
Wow,
home. And
that's
I
cool.
learned Photoshop when I was very, very young, in elementary school, actually.
Is that
That's
right?
what my dad taught. So he taught ceramics and painting, but also graphic arts. So I became pretty proficient with Photoshop. In fact, I think on the weekends, that's what I would do for fun. I would just sit on the computer and draw on the computer. So when I realized that I could do something that could reach more families by a book, I decided what a great idea. And it can kind of tie in that arty side that I kind of forgot about. So it's been a fun journey. The characters in it were actually inspired by myself. So when I was a kid, I kind of looked like this little girl with glasses, and I had a beagle named Clancy.
Love the name, by the
So
way. Super clever name. I
you
love
know
the name
what? Like,
Clancy.
I didn't get to that was my parents. We had 2 Clancys, it's really funny. But before I was born, my parents had Clancy the beagle, and then he passed away when I was in 2nd grade, and we got a new Clancy, Clancy number 2.
That's awesome.
So I've had lots of Clancys in my life, and they were both beagles. This book, I put some information, like parent tips and things like that, and things to look for. I think my favorite part that I'm hoping will help parents is just this simple, like, window. It seems weird, but I created this little window because I wanted parents to cover their child's eye, have them look out the window, and even if they're not drawing, but at least describe what they're seeing outside, and then do it with
Right.
the other eye. So there's pages in here where they're doing one eye, out the window. And then I also have some where they're looking up close, which I just made simple boxes. It wasn't anything fancy, but basically to have a child, I said, look for 3 toys that you see close by and draw them here, but with one eye at a time. So kind of the same thing, trying to get the parent and child to do that covering that I was talking about, because sometimes a parent doesn't realize that their child's not seeing. The other thing that I think is really fun in this book that I made these little tiny, very gray paw prints, and this can actually help with tracking because the child has to kind of look around on the page. So if you see there's like 1, 2. So I just did a new thing where I made a little paw print up here and put the number of paw prints so that now it's not on this one, but on each page it'll show how many paw prints there are. But I think that's one of the fun things for kids that they like in the book is that they can look for paw prints. And then some of them I just made like fun coloring, because even coloring is helping hand-eye coordination and things like that. But there's a big section in the back that's all about one eye and another, even tracing like wiggly lines. So that also helps. And it can help people who do have amblyopia because they can use their patch. And these kids who need to be patched who have amblyopia, the lack of vision in one eye, basically, trying to stimulate it, need to find tasks to do to stimulate the eye. So, we patch it, but they can't just like sit and stare into space. They need to stimulate the eye to get the visual pathway working. So if they do have amblyopia, they could also use the book and do things with one eye to help develop. I made like little mazes. I try to make it fun, but and then I also just kind of put things for parents, like, for instance, when to get eye exams and what to look for, and even like what these activities do, the different activities in the book, and how it helps with kids and detecting if there's a difference between the 2 eyes. So
So
obviously it doesn't place an eye exam. It's just more, this is an entertainment book, but it was my way as an eye doctor to try to help kind of get communicating with their child about their vision, things that they may not notice.
I think it's genius because number one, it's interactive and gets kids away from like a tablet or a screen of some kind. It's actual like old school, like coloring, drawing, see where they're like actually creating and doing things with their brain and not just sitting staring into a screen, which I think is gone way too far in this day and age with children. And on top of that, you again incorporate things that help the parents identify what these kids are putting on these pages. The whole looking out the windows and draw what they see. It's like that doesn't look right. They can say, "Hey, Dr. Mulick, this kid just drew this. What does this mean?" And so it gets and not only interactive for the kids, but it also engages the parents of that child and forces them to really pay closer attention to what's going on with that kid's vision. I think it's
I think
genius.
that's kind of the main thing I was going for, is just, I feel like in the field of optometry, there isn't enough public education as far as why we need eye exams, and especially kids, but even adults. I had an adult the other day. He was, I think, 60 or something, and it was his first eye exam. And I'm going, what? Your first eye exam? How could you be 60 and have your first eye exam? But I think people think if I don't have a problem, I see fine, I don't need an eye exam. I think that's a very poor misconception. And I do think it's, I like what you're doing here because you're trying to educate the public. And I think the more we can educate the public about why we do what we do, we can help kids who may be struggling in school or labeled as a problem learner or, having problems with their attention. Often it might just be that they need glasses, unfortunately.
Well, Dr. Stephanie Mulick, Thank you for joining me today and for sharing such an inspiring look into the power of pediatric vision care. Before we go, how can members of our audience contact you to keep the conversation going, and where can they buy the I See It activity book series?
So they can contact me multiple ways. I have a little blog I made back in 2020. I haven't been great at keeping up on it, but I did write 50 articles about eye care, and I have a whole pediatric section on there. And that's called askidoc.com. That's one way. And I mean, if someone wanted to email me, we could do that as well. But I'm at Tayani Institute, and we have a website called tayani.com. And that's probably the easiest way to get a hold of me because our office numbers there and everything.
Okay. And again, where can they find I See It book
Oh,
series?
yes, thank you. So right now I have it on Amazon.
Oh, okay. Yeah, I did see
And
that. It's 4.8 on 4.8 stars, by the way. I looked at it before we jumped on here. 4.8 stars on
thank
Amazon. And
you.
that's powerful.
I'm
Anything above a
still
4.2
trying.
is huge.
Oh, thank you. I'm still trying to get reviews. That's like the main thing. So I've been sending people PDFs and things like that. Although PDF's not quite the same as the book, but just so they could look at it and see what they think.
Cool. To our listeners, remember, a child's world becomes a lot brighter when they can truly see it. Schedule that comprehensive exam. It can make all the difference. As always, we'd like to thank Riverside FM and Passionate Media for making this show happen, and Meridian Medical for making it all possible. And to my audience, the Q-Switch Conversations podcast is my way of giving back to an eye care industry and community that shaped my career, my perspective, and my passion for what we do. This platform is truly for you, the clinicians, the innovators, the change makers, redefining what's possible in our field. So if you got a fresh perspective, unique experience, or know someone doing great things in eye care, I'd love to feature you on the show. You can hit me up at on LinkedIn or drop me a note at d.spence@radian.ch. That's a wrap for this episode of the Q-Switch Conversations podcast. I'm Spence, and I'm out.
You're listening to The Q Switch with your host, Spence.